I'm Kristen. I'm a clinical instructor with International Career Institute. We'll be going over part 3 of a 4-part series in regards to cardiac nursing. In this video, I'm going to teach you all about beta blockers and what we use them for. This is going to help you pass your exam or help you pass the NCLEX. This is a straight-to-the-point video, and it is all interactive. There are 2 major goals of using beta blockers. 1 is to decrease the blood pressure, and 2, slow down the heart rate. Question: what are the goals of using beta blockers? 1, decrease the blood pressure, and 2, slow down the heart rate. One of the most frequently used beta blocker medications in the hospital is metoprolol. Metoprolol ends with LOL, like most beta blockers. There are 2 types of beta blocker medications: non-selective and selective. Okay, let's review. What are the major goals of using beta blockers? What are the most common types of endings that you'll see with beta blocker medications? And what are the 2 types of beta blockers? The 2 major goals of beta blockers are 1, to decrease the blood pressure, and 2, slow down the heart rate. Most beta blocker medications end with LOL, and the 2 types of beta blocker medications are selective and non-selective. There are 2 types of beta blockers: selective and non-selective. Selective beta blockers target beta-1 receptors. Non-selective beta blockers target beta-1 and beta-2 receptors. Selective beta blocker medications target beta-1 receptors in the heart. Non-selective beta blocker medications target beta-1 receptors in the heart as well as beta-2 receptors in the lungs. Let's review. There are 2 types of beta receptors. Beta-1 receptors are receptors in the heart, and beta-2 receptors are receptors throughout the body but focus on the lungs for this medication. There are 2 types of beta blocker medications. Selective beta blocker medications target beta-1 receptors in the heart, and non-selective beta blocker medications target beta receptors 1 in the heart and beta-2 receptors in the lungs. Now it's time for a quiz. What are the 2 types of beta receptors? What are the 2 types of beta blocker medications? What does each beta receptor target? What are the goals of the beta blocker medications? Here are some things to watch out for patients who are on beta blocker medications. Bradycardia, which is a slow heart rate of less than 60, hypotension, which is a low blood pressure, bronchoconstriction for patients with asthma and COPD, and masked hypoglycemia, which is a low blood sugar. Let's review. What are some things to watch out for patients who are on beta blocker medications? Bradycardia, bronchoconstriction, hypotension, and low blood sugar. All right, it's time for a quiz. What should we look out for patients who are on beta blocker medications? Bradycardia, which is going to be lower than 60. Bronchoconstriction for patients with asthma and COPD. And why are we also going to test someone's blood sugar? Because it can mask hypoglycemia. Now it's time to review everything. What are the 2 goals of beta blocker medications? 1, decrease the blood pressure, and 2, slow down the heart rate. What are the 2 types of beta blocker medications? Selective and non-selective. What are the 2 types of beta receptors? Beta-1 receptors target the heart, and beta-2 receptors target throughout the body, but this medication will focus solely on the lungs. The most common ending from beta blocker medications end in LOL. Some things to look out for beta blocker medications are bradycardia, hypotension, hypoglycemia, and bronchoconstriction.